jail visitors project. And volunteers have been staffing a table outside of the jail on the weekends during visiting hours to interface with family members and with friends that are visiting their loved ones in the jail. And we have a form that these people can fill out if they have a concern about an unmet medical need. And I've heard that so far our volunteers have collected 50 such forms and provided them to the jail medical contractor. Now, these concerns have not always been addressed in a timely fashion.
And that is your time.
So there's room for improvement.
Thank you.
Thank you so much.
Lynn Gibbs, our next speaker, to be followed by Roy Stauffer.
Honorable Supervisors, my name's Lynn Gibbs, and I serve on the Community Corrections Input Group. And I'm not qualified to speak on the choice of contractor. That's kind of above my volunteer pay grade, and so I'm not familiar with the selection process, and that's appropriate. But I did want to speak to the standard of care, which I think is very important. And I know that the Sheriff's Department looked very carefully at that in composing the RFPs. Working with family members of persons with serious mental illness in the jail, I know how important psychiatric care is, and how important it is to have a full-time psychiatrist on staff. So I was glad to see that included, as well as an upgrade that the department's already made an intake to have an RN in charge of intake, and that's helped a lot in getting people back on their medications when they get to the jail, or enabling them to continue the medications they've been on. And the sooner people can get stabilized, then the better off we all are, and the sooner they can get out of the jail. So I think that that's really important. And I'm glad to see so much attention was paid to it. As well, it seems really important to track performance. And the measures that were defined look like good ones to me. And I expect that the Community Corrections Input Group will have the opportunity to work with Mark Maheran, the grievance coordinator, to review that tracking as time goes on. So thank you.
Roy Stauffer.
Madam Chair and members of the board, I'm Roy Stauffer, a board member of Families Act. I congratulate you on having selected a new jail health care provider, California Furnistic Medical Group. We must remember, however, that they are not a public agency, but a private for-profit group, and as such must be closely monitored to see that they provide the care we expect. The monitoring occurs in part through a county employee, the grievance oversight coordinator, who inspects all grievances filed in the jail, attempts fixes, reports any problems, independent of the sheriff. A very good program. Attachment A of your board letter covers safety cells and ways to minimize the time that an inmate stays in one. Safety cells inmates are unable to file a grievance, so there is no external monitoring of this program to see that it is complied with. Mental health personnel are required to file a safety cell step-down form when anyone has been in a safety cell for more than 12 hours. I suggest that the grievance oversight coordinator be allowed to monitor these safety cell step-down forms as well as grievances. This would extend outside monitoring into another area of the jail medical care, one where the inmate cannot defend himself. Thank you for listening to my suggestion.
Thank you. Supervisor Wolf?
Was that our final public speaker?
Yes.
Okay.
You didn't have a question for the speaker? You
No,
just
I
wanted,
just
okay.
wanted-
Let me first bring it back to staff and ask if there are any clarifications or anything additional you wanted to say in response to public comment. Okay, Supervisor Wolf.
All right. Well, thank you, Madam Chair, and thank you to those who spoke today. Many of you know that when I came onto this board 10 years ago, this issue of privatizing mental health services in the jail was concern to me. That's when it came to the board, and I was opposed to it at that time. But we worked with our provider, we worked with our sheriff's department, and I think it was approximately 2 years ago when there was more information. We had our provider at that time come to the Board of Supervisors and give us updates. And we also had our stakeholders come. And I think because of that input that we were getting from our provider, the sheriff was very responsive. I want to thank you, Sheriff Brown. I think the grievance coordinator has done an excellent job in working with our stakeholders, and I'm pleased to hear about this new program that you have outside the jail. But the fact that there were 50 requests, apparently, I think that information should also be included in the grievance coordinator report when we hear from when we hear from Sergeant Mahurin, because that's something new, a new protocol. So it would be good to include that. You know, when we were going out for an RFP, I was hoping that we would have public health and behavioral wellness be able to bid on the RFP, so that we might be able to bring back our departments into the fold. We have behavioral wellness working in probation, so that was my hope, but I understand that might have been too much at this time for our departments to take on. So we went through this RFP process, and I think it was very extensive. We had an outside consultant work with us, and to all of the folks who were involved in that process, I want to thank you again, because I think it was very well done. You have incorporated within the contract, and we saw today that behavioral wellness and public health will be involved to some degree. And I was also really pleased to see that within the contract, even though I didn't see it initially, you folks pointed it out to me that it's in the contract, and you mentioned it today, that the Board of Supervisors will get an annual review, making sure that they are meeting the standards that we set out. And the standards, I think, are very well thought out. I think they address the concerns that we've had as a board regarding medication, making sure that folks who come into the jail, to the extent possible, are given the same formularies when they're outside of the jail, and that they're given those medications ASAP. So, I mean, there's a timeline for all of this, and I think it's very helpful. There is also the issue of, I'm trying to think of what the de-escalation piece that we had actually instituted, I think it was maybe a year ago, continues to be part of this contract. I think that together, this Board of Supervisors and the Sheriff's Department, the CEO's office, and the stakeholders has done a really good job in bringing us this contract. And at any point in the hearing, it might be good to hear from Correctional Health Services. I'd like to hear from one of you about what you foresee in the future working with the county. And I want you to know that it's very important that you understand, which I'm sure you do from all of the meetings with our staff, how important this issue is to the Board of Supervisors. Mental health services in the jail, medical services in the jail is of utmost importance to us and to the community and to the inmate. So we want to make sure that those services are provided in the quickest and most appropriate way as possible. And so we will be monitoring the progress that you're all making, and we thank you. I thank you for being here. And Under Sheriff Malakian, thank you very much. I just want to thank you personally for your work on this, and of course to all of your folks who are working in the jail day in and day out. I know that it's not an easy task. And I'm just going to go back to the contract again, because there are some statements in there about custody working directly with you folks. So I hope that cooperation and commitment remains. And to probation, you guys, what you have right now is terrific. I've seen the mental health, the health services that are going on in probation, both at the hall and at Los Prados, and I think it's exceptional. So I want to thank you for all of the work that you're doing in probation. Thank you. Thank you, Madam Chair.
Supervisor Lavanino.
Thank you, Madam Chair. Well, I think the speakers were talking to the level of commitment from the board. I think I would point to the fact that this is actually a $1.2 million increase, more than that. So I guess that's one of the questions for the CEO's office is, in the fiscal impact to the sheriff's office, this is close to $1 million a year impact, and to probation, close to $300,000. So just curious how we're planning on covering those increased costs.
Chair Lavanino, Supervisor Lavanino through the chair, in their board letter, you can see in the fiscal impact, it shows that the annualized contract variance is about $2 million. So this contract is about $2 million more than funds currently budgeted in probation and sheriff, the lion's share being in the sheriff's department. So this is part of our budget deficit that we'll be reviewing with the board next week and from now until June adoptions. So what this means is that of our deficit that we've shown to the board, this $2 million will be made up through cuts, either in these departments and in other general fund departments.
Supervisor Williams.
I just briefly wanted to mention that I share the long-term concerns that were well articulated by Supervisor Wolf, though I also don't see a immediate other option cropping up, and so I suppose reluctantly we'll be supporting the recommendation.
Supervisor Wolf.
Thank you, Madam Chair. And the cost of this contract certainly caught my attention, but I think we knew going into this that there was going to be an increase in cost. And that's why I stress that we expect an increase in the work product and the coverage that we're going to see. So, I look at it perhaps a little bit differently. I look at it as a preventative measure for the county. When you look at potential lawsuits and issues that come from not providing the services that we are, I guess we're required, but I think we're morally responsible to provide. So I think that that this is an appropriate investment in return getting excellent services, and that's the expectation.
Supervisor Lavanino.
Thank you, Madam Chair. No, I totally agree. I just want the public to be aware that sometimes they think we're shortchanging this area, and I want them to know that we are actually reprioritizing inside the county, having to make cuts in other areas to add more money to what we've heard many times from the dais is a priority of theirs. So just want to make sure that that's clear.
Supervisor Williams.
On the cost and on the points mentioned by speakers, though, I think one of the long-term issues that this brings to the fore is the question of whether it really is appropriate for us to have as high of a misdemeanor arrest percentage in this county. We have one of the highest or the highest and in the state, and one wonders, is that really appropriate, and where we don't completely know where those folks are coming from. Meaning we don't know if that's sheriff's arrests or if that's city police arrests. But for most of the mentally ill that are being arrested on misdemeanors, there are better places for them and cheaper places for them than the jail. And I, for one, I just want to say my patience with this is not going to be very long-lived. This is not the way we should be handling this population.
Supervisor Wolf.
Thank you, Madam Chair. Just to follow up on Supervisor Williams' comment, we do have, and we're working closely with the courts on a pretrial program, and I think that that will help reduce the number of folks who are in the jail. Sheriff Brown attended with me and others a Stepping Up initiative that is looking at diversion for folks who are committing misdemeanors. And, I should mention Dr. Gleghorn as well, moving them, rather than bringing them to jail as the first option, is getting assistance through our crisis stabilization unit. So I think there's, I think your comments are well taken, and I believe that there is an effort in this county with all of the partners, the public safety partners, mental health, probation, working together to address the issues that you're bringing up. And thank you, Supervisor Lavagnino, for clear comments. Thank you.
Supervisor Wolf, would you like to make a motion?
Thank you, Madam Chair. Okay, I will, there's probably a lot of things to, I will make a motion that we move forward with staff's recommendation. Oh, before I do that, if you don't mind, can we hear from CFMG? I'm sorry, Madam Chair. Tell us who you are.
Sure. Supervisors Chair, I'm Kip Hallman. I'm the CEO of the company. I'm here because we also care about this. I heard the speakers, and I don't disagree with much of anything that they said. This is what we do. It's very important work, and we are passionate about it. We currently serve 29 of the 58 counties in the state. Santa Barbara will be our 30th. And we have served that population in those counties for an average of about 15 years. So we have very, very long relationships with our county customers, with the people we serve. And the reason for that is because we do what we say we're going to do. And this starts with I think, from me all the way through the folks that work at the front lines of our company, we care about what we do. We care about the people we serve. We care about the inmates we take care of. And the people that work with us, our employees, have an average employee level that's much like our customers. They're with us decades, and because they care about this work. The most important thing we can do to change the quality of care provided in your jail is to make sure that every day, everybody who is supposed to be there providing care is there. That's the first thing that we do, and we take that very seriously. I think across the state, the number of people that aren't at a post today, there are a number of unfilled posts. If there are any, I could count them on one hand. We just don't leave positions vacant. First important thing. Second thing is the people we bring in to serve this population. We are very careful about who we hire, and we take that seriously. We pay people well, and we make sure that we have people who, when they show up every day, they're excited to be there. They care. They're not just there to fill the hours and punch a clock. And so that's what's allowed us to continue to do what we do, and why we serve now 30, hopefully today, 30 counties in this state because of that. And so, we will be available from my level down. My business card, if somebody calls the number on my business card, it rings my cell phone. I'm very accessible. I'm here today for that reason. So, you know, we appreciate what you guys are doing. We appreciate what Sheriff Brown is doing and his department is doing. Interestingly, I was also at Stepping Up. We actually helped fund Stepping Up in California. We think this is a very important thing, and so we also agree that, you know, trying to take people who shouldn't be in jail, if we can help move those people into other places, that's a wonderful thing. Our job is to take care of the people that are in the jails we serve, and we do that well, but we're certainly supportive of you know, this population. So, best thing. Thank you.
Thank you very much. Okay, Madam Chair. Oh,
I'm sorry, Supervisor Wolf. Just one other thing I just wanted to tell the board for full disclosure, and that is that, the speaker spoke to it when the presentation. So this is for the existing South County Jail. When it comes time for the Northern Branch Jail, we have an ability to work with the contractor, but just to remind you, also in the numbers that we have and for the operating fund, we've included services. We included some escalation, but I don't believe we included escalation that would cover these types of costs. So we'll be reviewing that and coming back to the board when we look at the operating costs for the Northern Branch Jail.
Okay. All right. Thank you, Madam Chair. I'll move this item recommendations A, B, and C as noted in our agenda. And thank you very much.
Have a second?
I'll second.
And could we have a roll call vote, please?
Mr. Lavanino? Mr. Williams? Ms. Wolf?
Aye.
Mr. Adam?
Aye.
Ms. Hartman?
Aye.
Passes 5-0.
Thank you. I'd like to take a 10-minute break, and then we'll come back to agenda item number 3 on our departmental agenda. She thinks it can go faster. You go to Darren John too. There's a whole bunch of us, yeah. Lois does. Yeah. They have quite a little list. I've been going for a long, long time. Yeah. Oh. Oh, Christina, she just cuts it for me. Mel Davos, I think. Anyway, she's been there for quite some time. Oh, thank you. I like yours. We ready to go? So please take your seats. We're reconvening the Board of Supervisors meeting of February 28th, 2017 here in the Santa Barbara County hearing room in Santa Barbara. And we're turning to agenda item number 3. Mr. Allen, would you read that into the record, please?
Chair Hartman and members of the board, item 3 is from Behavioral Wellness. It's a hearing to consider recommendations regarding the alcohol and drug programs, drug medical organized delivery system demonstration waiver implementation plan overview.
Okay, Dr. Gleghorn.
Good morning, Chair Hartman, members of the board. I am coming before you today to follow up on a presentation in May of 2016 on the opportunity for drug medical expansion through the organized delivery system 1115 waiver. And I'm going to walk you through some of the details of our planning process and the plan that we will submit to the state. I'm happy to go into more details, but I do not anticipate that it's going to take the hour and a half that we agendized for this. So that is my goal for today. So on May 3rd, 2016, we introduced the Drug Medical Organized Delivery System, affectionately known as ODS, to the Board of Supervisors. We were asked to return with an outline of our plan before submitting the plan to the State Department of Health Care Services for approval. The Drug Medical ODS system will improve the quality and availability of substance use disorder services for California and Santa Barbara specifically beneficiaries. It will expand and enhance the existing drug medical covered benefits. It will give county officials more authority to select qualified providers and create a consumer-focused and evidence-based system of care. Critical elements of the ODS include a continuum of care modeled after the American Society of Addiction Medicine, known as ASAM, criteria, increased local control and accountability for our providers and services, greater administrative oversight, utilization controls to improve care and manage our resources, evidence-based practices as a requirement, coordination with other system of care, and expanded benefits. So this is a very brief sketch of some of the current drug medical benefits and some of the expanded benefits that the organized delivery system will allow us to include within different modalities of services. So currently we're able to provide group counseling, individual sessions for assessment, individual crisis sessions, outpatient treatment plan review sessions, and discharge planning individual sessions. The expansion would include non-perinatal residential treatment services, case management services, recovery support groups, and/or individual sessions for aftercare services, withdrawal management, and regular individual sessions in addition to the currently covered sessions. So highlights of the Santa Barbara implementation plan include a fully collaborative planning process that was conducted in the last year, provision of all of the required service benefits, inclusion of some optional benefits, including medication-assisted treatment services, possible inclusion of medical detoxification and recovery residents, also known as sober living services, if we're able to expand those, emphasis on quality control and quality management, extensive training and technical assistance, and a competitive provider selection process. So we will be required to provide under the ODS early intervention, outpatient services that would include intensive outpatient treatment and naltrexone services, residential treatment. Currently, we're limited to perinatal residential. This will add residential treatment for all other populations. Narcotic treatment programs, which exist currently. Withdrawal management at least one level. Recovery services, case management, and physician consultation. Our county responsibilities in implementing the organized delivery system include conducting a selective provider contracting process. It also includes access, specific selection criteria, a contract denial and appeal process, and specific provider requirements. Just for clarification, currently under the existing drug Medi-Cal system, any provider can become drug Medi-Cal certified at the state. This will allow us to conduct RFPs where we select specific providers. We do not have to contract with all providers under the ODS. Additional county responsibilities will include authorization for residential treatment, a beneficiary access number, which is open 24/7 and is toll-free, beneficiary informing upon the first contact with the individual, care coordination, quality improvement, utilization management, and a county implementation plan and contract with the state. So what is our timeline for this? We plan, once this is approved by your board, to submit the final version of our plan to Department of Healthcare Services by May 1st. The approval process for CMS, the federal government, and DHCS will probably take somewhere between June and July to obtain. If that is granted successfully, we expect our negotiation of rates for these services to happen in September and November, with final approval of the plan and rates in November of 2017. We would then come back to this board with the intergovernmental agreement with CMS and DHCS in December. And this says to begin the provider selection process in January 2018, although we can begin conducting RFPs for our existing services sooner than that, and for the new services, follow up with RFPs at that time frame. And then finally begin delivering the organized delivery system services in fiscal year 18-19. So some of these items will depend on how quickly DHCS and CMS respond, but that's our initial time frame. I'm happy to answer any questions by the board, and there's plenty more details in the letter, but I was trying to limit myself to the slides allowed and the number of items we could squeeze onto the slides.
Do any supervisors have any questions for Dr. Gleghorn before we go to public comment? Okay. Mr. Allen, do we have any members of the public who would like to comment?
Chair Hartman, members of the board, one request today from Suzanne Riordan.
thought there'd be a lot more detail, and I haven't really followed closely what the department is planning to do. But it's obvious that the whole question of substance use is terribly important in many different areas that our county government deals with, including the jail. It's terribly, terribly important. And one of the things that I realized as I was reviewing the news stories about inmates who died under the care of this group that we've just contracted with, is that it appeared that the vast majority had a substance use problem, and that it made them very vulnerable physically and emotionally and mentally, and in terms of on all levels when they entered the jail. So it's critically important. Historically, our county has really not done enough to serve this population. I mean, the name of our mental health department was alcohol, drug, and mental health services, but the alcohol drug side of the equation has really been underfunded for so long, and it's just terribly important that we correct this, that we redress the balance. I guess that's all I can say right now. I'd like to work more closely with Dr. Gleghorn and see that we can do something. Residential treatment, we've been saying for 11 years since we've been standing here. Families Act has been saying it's critically important and severely lacking in our county. And, you know, one of the problems that we all have to deal with is that people who are sometimes needing a tremendous amount of help don't always volunteer for it. So that's why our organization has an interest in the proposal that Dr. Gleghorn has put to the Community Corrections Partnership to create a locked facility using the facility of the old juvenile hall for people that are considered incompetent to stand trial, and probably a broader population, but so many of them are going to need treatment in a locked facility that's not a jail. So I think that idea has potential, but we'll have to take a very close look at it, and I hope that the supervisors will be following closely the plan. And I do appreciate what Supervisor Williams pointed out about the misdemeanor arrest rates in our county. They're deplorable, and we've got to do something about that. And somehow we have to meet with the police department, the city, and the county sheriff's department, and the probation department, and turn that one around. And one thing that I'll mention, since there's a couple more seconds, the drug laws in our state have changed drastically in the last few years, but one area that they haven't really affected is probation violations. And if you look closely at what's going on with someone who's caught up in that revolving door cycle, who's under the supervision of probation, they constantly get rearrested for drug use, and in many cases, no help is coming to them. And it's a complex thing to resolve. Thank you.
Thank you. Supervisor Adam.
Yeah, what I'm not hearing about here, Dr. Gleghorn, is how we are going to be measuring success as defined by moving people through the system as part of this. Is there such a thing and I missed it?
Supervisor Adam, through the chair, yes, I could actually probably find the page for you, but the nice thing about the organized delivery system statewide is that as part of participation, we are required to provide data to UCLA, who is going to be conducting a broad outcome study of all the counties that participate. So that is a requirement. And the county alcohol and drug systems participate actively in the it's called CalOMS, the California Outcome Measurement System. So every client that enters into a treatment program is assessed at baseline, and then at prescribed periods for follow-up and at discharge. So this contract with UCLA will give them access to pull that data and analyze that data for specific outcomes in a broad sense across the state. So we will be part of that, and it's part of the obligation. If you look at the plan, there is a section on that.
So when did that start? CalOMS.
Oh, CalOMS. CalOMS has been in existence for, I'm going to say a dozen years. It's been about a dozen years. So.
Well, remember we talked about this for a long time, and we ended up being able to, the only thing that we could do, I never heard about this before. It's the first I've heard of this. And we were going to start with the cans and the mowers.
So those are measurements on the mental health side of the house. The system on the substance abuse side is different.
Oh, okay.
Mental health does not have a parallel quality outcome measurement system that's directed by the state. And so that's why we've implemented those measures locally. They have something that's very basic called CSI. I don't even remember what that stands for, but it's essentially demographic information. But the substance abuse system does have a much more robust, it's not perfect, but CalOMS does give you this level of information at baseline and at discharge and at intervals along if you're in more than 90 days. So we do have that ability on the substance abuse side. That was
So
not
we have that information
substance abuse
compiled
side.
for the last dozen years?
Yeah.
Wow.
Yeah.
Can
With varying levels of accuracy and completeness from the different providers, but it does give us something to work with. And the items in CalOMS are based on an abbreviated version of the Addiction Severity Index, the ASI, which is a recognized tool across the country for looking at substance abuse conditions.
Yeah, well, I would love to have us come back and have a report on where we are today and where we've started out historically and to see what the trends are on that.
Absolutely.
Yeah. Thank you.
Are there any other questions for Dr. Gleghorn? Any more comments? May I have a motion?
Madam Chair, I'll move this item, A, B, and C as noted in our board letter.
And a second? Supervisor, all those in favor say aye.
Aye.
Any opposed? Motion passes. So that concludes our departmental agenda for today, and we're about ready to recess for closed session. And Mr. Gazzoni?
Chair Hartman and Supervisors, today the board is agendized to consider one conference of legal counsel concerning significant exposure to litigation. My estimate is 90 minutes.
Thank you, and we are recessed. We will Good afternoon. We're reconvening the Board of Supervisors meeting of February 28th, 2017. And Mr. Gazzoni, would you report on our closed session, please?
Chair Hartman and Supervisors, the board considered one item of conference with legal counsel for anticipated litigation, significant exposure to litigation, no reportable action.
Thank you. With that, I adjourn this meeting and will reconvene on Tuesday, March 7th, here in the Santa Barbara hearing room.